Hi and welcome. I'm trying to learn medicine, today interventional cardiology, and after we've done that, we're going to do wrist training. And if you participate in the wrist training, that is at your own risk. Now, the procedures of interventional cardiology. The first one is angioplasty, and angioplasty is an intervention to dilate either arteries or veins. That seems to be the main procedure done by interventional cardiology. Percutaneous coronary intervention, or PCI, or coronary angioplasty. That is the use of angioplasty for the treatment of obstruction of coronary arteries as the result of coronary artery disease. A deflated balloon catheter is advanced into the obstructed artery and inflated to relieve the narrowing. Certain devices, such as coronary stents, can be deployed to keep the blood vessel open. Various other procedures can also be performed at the same time. After a heart attack, it can be restricted to the culprit vessel, the one whose obstruction or thrombosis is suspected of causing the event, or complete revascularization. Complete revascularization is more efficacious in terms of major adverse cardiac events and all-cause mortality. Okay, with PCI, that is the doing of angioplasty, so the dilating of arteries and veins. That is done by pushing a balloon, deflated, through the arteries to the place where it is narrowed, then to inflate the balloon, and then to open through the blood vessel again, and then maybe place a stent which holds like a pipe the blood vessel open. Now, what is now revascularization? Is that thing revascularization? And in this time, revascularization is done through angioplasty, which is a part of interventional cardiology. I understand it now that way. Revascularization. I'm not completely sure what the word means, but I think in this context now, or from this context, that it means to revascularize it. So to make the vascular system again vascular, whatever it means. So to take an obstructed coronary artery, to push a balloon through, to open the balloon, place a stent, hold it open, and that is revascularization. It can be done just as the vessel which had caused a heart attack, or if the one who was obstructed, which is a culprit vessel. Now I'm wondering a bit because culprit vessel, I said it 2 parts ago, is every time the blood vessel which was obstructed, the culprit vessel, or where it was, like here with thrombosis, like saying that was thrombosis, or whether the thrombosis was in the leg, or in the upper leg, or in the arm, it is thrombosis. Like the culprit vessel is the one which was affected, or is the culprit vessel the name for a specific vessel at the heart, and that is the one which is always the first one who has it. Now, because culprit, it sounds a bit like colpo, and colpo is in Italian the guilt, or the book. And also colpo, that is the damage. But it means basically, so it could be mean the culprit is the one who has caused it. But culpo is not culprit. But it's not completely clear from the used words in this text. The one whose obstruction or thrombosis is suspecting of causing the event. Or complete revascularization. Complete revascularization. Yes, I want to give a little conclusion. What do I think is it of these two options? I don't know. I can't decide. It sounds more like it is that one vessel, that is always one vessel to the most prone to becoming it. One vessel is the heart, everyone has it, and that is the one which first has it. Or complete revascularization, but I don't know it. I can't decide. Or complete revascularization. Complete revascularization is more efficacious in terms of major adverse cardiac events and all-cause mortality. I think the word efficacious means just effective, or is a similar term to effective. What if not? And that it means complete revascularization is better against cardiac events and the all-cause mortality. So it is better to do it completely. But They seem to have reason maybe not to do it completely. PCI is also used in people after other forms of myocardial infarction or unstable angina, where there is a high risk of further events. The use of PCI in addition to anti-angina medication in stable angina may reduce the number of patients with angina attacks for up to 3 years. Okay, some people have angina, some people have unstable, others have stable. If the people have stable angina and they're getting anti-angina medication, when doing the percutaneous coronary intervention, so to revasculate the coronary arteries completely with the heart, reduces the amount of angina attacks for around 3 years. But it does not reduce the risk of death, further a future myocardial infarction, or does it also not reduce the necessity for possible further interventions. Valvuloplasty. It is the dilation of narrowed cardiac valves, usually mitral, aortic, or pulmonary. Okay, it's from valve, narrowing cardiac valves, valvuloplasty. That is the dilation of narrowed cardiac valves, usually mitral, aortic, or pulmonary valve. These valves are the heart around the time right now. The aorta comes in, and where it comes in, so that the blood doesn't go into the aorta comes out. But the blood doesn't go into the aorta, the valve closes it, and the pulmonary goes to the lungs, so that the blood does not just go to the lungs, but just into the blood vessel, not to the lung itself. And the mitral is the one between the whatever atrium and the ventricle. It was seen from the heart of the left atrium and the left ventricle. So there's these valves, they are between the chambers and between the arteries and veins, and they can be also narrowed, and if they are dilated, that is valvuloplasty. Now it is the next procedure of interventional cardiology. We will do now the Wristtraining. If you were here for interventional cardiology, you can go directly to the next part. We will do now the Wristtraining. If you participate in the Wristtraining, that's the own risk. We're having a good and stable stand. Hands next to us, hands up to fists, and we bring the fists down. And again down. And again down. And up. That is the spotlight. The last time down. Up. Now the fists to the inside, to the outside. The flashlight. And that was the last time, and now we're doing a similar exercise, flat hands, and we're bringing them to the inside and them to the outside, the magician. Now we're having 3 rules. The first rule is that we're stopping immediately as soon as there's pain. The second rule is that we're going only as fast as we can go with a little bit of effort, which was the last time. And now flat hands and open up, the pancake flipper, close again. And the third rule is that we're not overdoing it, we just want to strengthen, not to exhaust. The last time open and close. And now with T-Rex in the morning. Long hands out, long arms out, flat hands down, and again up. And that was the last time. Now we're going to do the T-Rex in the gym. You can do it with or without a tennis ball. If you do it without, make just a strong fist with, press with moderate pressure on the tennis ball, and release again. And press again. And release. Press again. And release. And now switch over to the other side and press again. And release and press again. Release, and the last time pressing and releasing. Now the cautious big bang. Place your fingertips with one hand on top of the fingernails of the other hand. Press a bit and open slowly. And closing the side. And now we're switching with the other hand on top, and we're opening, and we're closing slowly. And now we're doing the Viertes Synthes fists, and open and close fists again. And the last time. And we're ending open. And the next exercise, if you want to skip it, you can skip it. We're doing first, you grab anxious to a fever, fist, and bring the fist down into flexion and press a bit from the outside. Now pull a bit from the outside. If you want to take a break, do a break. This exercise. Press on the top, we have quite some more. And press on the bottom. And with the other hand fist, bring the fist down into flexion, press a bit against it. Pull a bit from the outside. And from the top. And press on the bottom. And the next exercise is the bicycle bridge. Flat hands and bend the mental knuckles. Always good and still stand. Up again and the mental knuckles. And up again. Last time bend the knuckles. And over. Next exercise, the ice X. Flat hand. Bend it in the knuckles and press on all 4 fingers. And up again. Other hand. Bend it and press on all 4 fingers. And up again. Next exercise, you can skip it if you want. The frog testing the water temperature. Flat hands and bring them down with flat fingers. And now up with strong fists. Again down with flat fingers. Up with strong fists. Again down. And up. Down. Last time. And now we're doing the claws, and bend with the knuckles. No, not with the knuckles. With the fingers. So just close and open again, and again close, open, and the last time close, and open. Now we're doing the next exercise. Arms in, strong fists into flexion, and out, extension of the flat fingers. Again in, strong fists flexion. And out, extension flat fingers. Again, strong fists flexion. And out, extension flat fingers. Again, in, strong fists flexion, last round. And out, extension flat fingers. And we're in. And I think already the last exercise, the unfolding rocket boosters. Go to the set, long arms, strong fists, and bring the strong fists into flexion to the inside. Now to the outside extension flat fingers. Again, inside strong fist flexion. And outside extension flat fingers. Again, inside strong fist flexion. And the last one, outside extension. Flaring and to the inside. And we're ending with a bit relaxation for the extension to the toe muscle. You're going with moderate pressure over the middle part of the lower arm. One last time. On the other arm. And that was the Wristtraining. Now I said this is medicine, interventional cardiology. I'm going to do it into interventional cardiology, PCI. We talked almost completely about PCI. I didn't want with the people who've seen the last part, see this part. So I thank you very much directly afterwards. I thank you very much, and until next time.